Faith was 7 months pregnant when she started to feel sick in the middle of the night. She suffered diarrhea and vomiting and was worried she would lose her baby. Living in a remote community, she couldn't get to a health facility. But thankfully, professional help was just a phone call away.
At dawn, I phoned the local nurse. She told me what to do, how to bathe, what to drink. Then a few hours later, she came to help. She gave me first aid and then organized to get me to a clinic.
Faith's nurse was part of a UN-funded project which gives phones to medics and distributes their contacts within remote communities. Faith's healthy baby girl was born 2 months later.
I have the nurse's number. I can call them at any time to tell them what is happening with either me, my family or my friends, and they will come and help. So it makes me happy to know that I can reach them like that and that I have the link with them.
The UN project has provided telephone services for 20 medical facilities. It's proved an invaluable service for villages like Faith's. She lives in Quetta on the edge of the Gulf of Guinea. Rising sea levels mean the area is often flooded, cutting it off from medical services. The telephone consultation scheme does seem to be having a positive impact. Coastal towns like Quetta used to be severely affected by waterborne diseases like cholera and malaria. However, the mobile telephone scheme, which keeps up the levels of communications between medical facilities and communities even if they are cut off because of flooding, has dramatically decreased deaths because of those diseases. And project leaders believe it can stay that way.
The good thing about this sustainability is that the nurses themselves have seen the benefits. And in fact, a lot of them are beginning to even use their own phone to assist in the process, so that they are no more seeing it as a project, but as a process of health delivery. So the citizens are calling their own phones, just knowing the central phones. And then the central people are also calling the district hospitals, knowing their phones.
The project's also given confidence to healthcare providers working in rural clinics. Nurse Linda Nyarko says it's saved lives.
We have our doctors, the numbers of our doctors, the midwife, and for the phone, I can be using the phone at the same time offering that service to the client. So if a client is, the condition of the client is above me per se, I have the right to call my doctor. Then he will be giving me the directions to how to handle the person.
The United Nations, along with the Global Environment Fund, is investing nearly $2 million in this project and others like it across Ghana. Katerina Vitozzi, CCTV, Quetta, Ghana.